Hello. I'm sometimes asked what is covered in the cost of a consultation before surgery and the cost of surgery itself. What's the revision policy? What are the exclusions? So I thought it'd be really nice to set all of that out so it's really clear for everyone. Okay, so first of all, consultations. For cosmetic patients, there is a single consultation fee that is payable for a full consultation. That covers all preoperative consultations, however many there are, minimum of two, I recommend, but you can have more if you need to, and all post-operative consultations. You can see me again for unrelated things. So if you say you have your tummy operated on in 2020 and you decide in 2030 you want to have your thighs operated on, then you can consult with me for that for no charge. With regards to the consultation fee as well, you can transfer that no fee consultation to friends as well. So if you recommend me to a friend and they mention your name, they also pay nothing for their consultation. I think that's the most generous consultation offering in the industry. I hope so. And my reason for that is I don't want anyone not to see me when they feel they might need to, either for an explanation or because they're worried about a complication or they're worried about anything. I don't want cost to stop you coming to see me. So that's that. So if you do decide to go ahead and have surgery, then the surgical fee you pay covers me, the surgeon, the anaesthetist, the hospital, which includes the use of the operating theatre, the equipment that's used as part of it, the operating theatre staff, and your inpatient stay. If you unexpectedly require a longer inpatient stay for medical reasons, then there is no extra fee charged for that. That's still included in the hospital fee you've paid. Rarely, a patient might develop a complication while they're in hospital. For example, we might detect a hematoma and I would want to return you to theatre to evacuate that, to remove it and to stop any bleeding. If that were to happen, then we would cover the cost of that. There would be no additional fee to you, and that would include if you needed to stay in hospital longer as a result or required more medications or dressings, whatever it may be. So you don't need to worry about events such as that. What about cosmetic dissatisfaction? Because I think people going into a cosmetic procedure have that as one of their main concerns, whether that will be covered. Thankfully, that's pretty rare, and I am fussier than most of my patients are. So that keeps that problem to a minimum. But what if it does happen? Okay, so prior to surgery, you and I, between us, will define what we think is a reasonable outcome, what we're likely to achieve. And then you decide whether or not to proceed on that basis. If that reasonable outcome has not been met, then I will correct that for you free of charge. I'll give you some examples. I tell patients consulting with me for a tummy tuck that their scar will be hidden by whatever underwear they like to wear usually, and I tell them to wear that on the day of surgery so I can mark it. Now, if after surgery the scar is not hidden by that underwear, then I would revise that for you free of charge. That would be covered by me. What else? I tell patients with a separated muscle that is being repaired as part of a tummy tuck that I will repair that separated muscle for them and that will hold for the long term. Again, if you were to exhibit a failure of that muscle repair despite obeying your post-operative instructions, then I would take you back to theatre and I would fix that for you as well. I've never had to do the latter. I have had to move a scar both upwards and downwards with patients in the past, thankfully rarely as well. Okay, so that's what is covered. What about what isn't covered? And in the sense of cosmetic dissatisfaction, what isn't covered would be if the surgery does fall within what we have considered will be an acceptable outcome in advance of surgery. So I'll give you an example of that. During liposuction, I tell people that I can reduce the pinch thickness of an area that's liposuctioned by around 40%, 40 to 50%. And so after that, a patient may decide actually they would like more liposuction than that. They would like the area to be reduced further. That's fine, but if it has been reduced by 40 to 50%, as we said it would, then that second episode of liposuction is a second procedure for which there would be a fee. What else? If someone, say, is having a mini abdominoplasty, I will warn you that it's impossible, it's mechanically impossible, to tighten skin above the belly button with a mini abdominoplasty. If after surgery you were to have loose skin, above the belly button after a mini abdominoplasty, then that is really what we are expecting, and there would not be a free revision for that, because again, that is now asking for different outcomes, different surgery. Can I think of another example? Yes, so massive weight loss. If patients who have experienced really significant weight loss go on to have skin tightening surgery, such as a tummy tuck or arm lift, thigh lift, breast lift, I warn such patients that the skin tightness won't be maintained in the long term. Week one, it's really tight, and then it finds a new equilibrium over the months and then settles to a new equilibrium. It's still much tighter than it would have been but for the surgery, of course, as otherwise what's the point of the surgery? But it won't be as tight as it had been immediately after surgery. That's not something that would entitle a patient to revision surgery, because that's normal, it's expected, it's just bodies behaving as we know they will behave, and it is explained in advance of surgery. The long and the short of it is, you and I will agree between us what the acceptable outcome is, and we will quantify it. So if I tell you you'll get a 40 to 50% reduction in pinch thickness of an area of your liposuctioned body, then we will measure that pinch thickness before, we'll be able to measure it afterwards, we'll very clearly see whether that has or has not reasonably been met. So I hope that helps clarify what is and is not covered as part of your consultation and surgery care. Any questions, please, as always, just let me know. Until later, take care. Bye now.